Welcome back to Talk of the Town. I'm joined now by one of our news partners, Medicine Shop Pharmacy Monona, and a familiar face here, Eric with the Medicine Shop. Thank you so much for being here today.
Thanks for having me back.
And today we're talking about medication therapy management. So I guess to start off, what is this all about?
Yeah, so the title kind of gives it away.
Yeah.
But pharmacy these days is really going towards away from just a dispensing role and more of an advisory role. And doing more things than just simply filling a prescription and asking if you have any questions going out the door. They're really taking more of a therapeutic approach.
Okay.
I mean, when I went to school, there was a big push for that. To make sure that people understand their medications, know that you're as a pharmacist, you're a part of the healthcare team, similar to the way the doctors are. You're the medication experts, and you really have a valuable place within the healthcare system. And so medication therapy management is along those lines. What it does is it sits down with patients, goes over their medications, talks to them in very specific terms about what side effects they're having, how they're taking their medications, and maybe suggesting some changes in dosing times or different medications, or getting rid of duplicated medications if they're taking more than one medication for the same thing. So it's a little bit more specific, targeted approach to people's medications to sit down and go through that with the patients.
Now, who qualifies for these services?
Yeah, really anybody, and the major groups that are pushing this, though, are the Medicare patients. A lot of Medicare Part D, which is the drug portion of Medicare, have plans in place, or I should say programs in place as a part of their plan to have these services done at no charge to them.
Okay.
It was actually mandated when they made the Medicare changes to put in the Part D plans that these companies, these insurance companies, actually have these programs available, because every study they've ever done that has looked at that kind of stuff has seen that it reduces the healthcare costs across the board by actually having the pharmacist that involved and getting rid of any medication issues that are leading to further health issues.
Sure. So I know you kind of touched on this too, but why and how would patients benefit from this service?
Yeah. So a couple of things, and I did mention it before, but it's things like maybe you have two medications that you're taking for the same thing that aren't really necessary. It's also, you might be taking a medication to treat a side effect of another medication, and maybe the best thing to do is just maybe change out that medication that's causing the side effect rather than having two medications. It's also, is there anything missing? A lot of times, there's a standard of therapy for different disease states, and what's best is to make sure you're on the recommended things. So those types of things are great to catch in those targeted interviews in those management sessions.
And I know you touched on this too, but is there a cost for anyone who wants to use this service?
It's always best to check with the insurance company and check with your pharmacist, because there are possibly some out there, depending on if you're in your deductible phase, meaning you're paying out of pocket. If you do it early on in the year and you're meeting that deductible, that may cost the patient something out of pocket. But for most insurance companies, it's not going to cost the patient anything.
Now, how are pharmacies paid for this program?
Sure. So again, in the Medicare program, the insurance companies are required to have it. And so the insurance companies pay us directly.
Sure.
And that's the way, honestly, most times it happens, is the insurance company, because of the benefit of them maybe not getting rehospitalized or saving money on other medications and things like that, they save money on that, so they're willing to pay for that service directly to the pharmacy because of those benefits to them.
Now, do all pharmacies provide this service?
Not necessarily.
Okay.
Again, it's be something that you would check with your pharmacy. Sometimes they will contract out to people over the phone that will conduct those interviews over the phone and things like that, so it's best to check with the pharmacy.
Now, Eric, where can people go for more information if they want to learn more about this program?
Again, I always advocate talk to your pharmacist.
Yeah.
We're there to help. We're there to have that conversation with you. We can definitely go through the different options that are possibly on the table for you. Maybe even some opportunity for follow-up and things like that. So at the Medicine Shop, we're more than happy to sit down and talk with you about that. If you don't have that relationship, we still encourage you to come in and talk to us about that kind of thing. Because there's a lot of times, even if you're not a patient of ours, if we have all the information in front of us, we can still conduct those therapy sessions. So
wonderful. Always great information, Eric. Thank you so much for being here today.
Thanks for having me.
And be sure to stop by the Medicine Shop Pharmacy in Monona if you do have any questions. And they're located at 4205 Monona Drive. Thanks for watching Talk of the Town. We'll be back right after this.